Hi everyone, I'm Mark Albert. This is Dr. Tracy Cook. We thought we would do segments every so often where we talk a little bit together about what each other does. I'm the facelift necklace specialist of the practice. Dr. Cook handles the breast and body, an emphasis I would say on breast and revision breast and aesthetic breast. To get things started, there are a few things that I've been thinking about, and I often wonder how in the world do these things happen and how do we avoid them from happening? For example, I'm sure a lot of viewers have seen before and after pictures where there are stretched, irregular areolas after breast surgery. I'm just curious, what is that all about and how do we avoid it?
Yeah, sometimes that happens when you undergo just a periareolar or mastopexy. I actually don't do that approach. I do a wise pattern, meaning you get the vertical and the horizontal. If you have too much tension around the areola, it can spread and become much larger, which in the long run is just not appealing. It can also flatten the breast profile.
The idea is we don't want to be doing mastopexy with just an incision around the areola. That's what
Yeah.
I'm saying. How about after a breast aug, when you see the breast tissue hanging off the breast, like a waterfall deformity or something like that? How does that happen?
Yeah, this has become actually a big issue, especially with patients on GLP-1s and they're losing a lot of weight. And back in the day, they would put all implants under the muscles, so that tissue tends to lose elasticity. And with the weight loss, you get a lot of droopiness. So the implant is trapped up high under the muscle and the tissue falls. Really, you just need a breast lift and maybe a plane conversion to a subfascial plane from under the muscle to now above.
And lastly, sometimes after breast augs, I've noticed that there are times where you can really see the edge of the implant pretty noticeably. I'm just wondering, how do you avoid that?
So I use 6th generation Motiva implants. They're a little more cohesive, less prone to rippling. You can also do some fat grafting at the time or a later stage after your breast augmentation. Or if you're extra thin and you want more soft tissue coverage, you can place the implant below the muscle. Great questions for the breast world.